Now, months ago, we warned you that hospitals, especially ones struggling financially, had an incentive to fudge COVID numbers. Now, why would they do that? For the higher reimbursements they'd get from the government. That's why. And it's not a fringe theory. USA Today fact checkers confirm that hospitals do get higher federal payouts for patients with COVID. So in other words, I'll explain it this way. A death caused by a heart attack may be logged as a COVID death if the patient tests positive for the virus. Get it? So the question is, how pervasive could this be, and is it inflating our COVID stats? We may soon get some answers. The Trump administration announced this week that hospitals that do not properly keep track of COVID and influenza patients could lose their Medicare and Medicaid funding. Ouch. Joining me now is Alex Berenson, author of Unreported Truths About COVID-19, and Phil Kerpen, president of the Committee to Unleash Prosperity. Alex, now, is this just paranoia on our part, or is there an incentive to misreport facts, or at least maybe it was the proximate cause, but not the, actual real cause? Because a lot of these local hospitals are cash-strapped.
So we're sort of talking about two different issues here, Laura. It's clear that hospitals do get a higher reimbursement for COVID cases. That's been known since March. It's not a secret. They get a 20% bonus. Now, there may be more PPE. These may be more intense cases. So that may make a certain amount of sense, but it does encourage hospitals to code every possible patient they can as a COVID case. Death counts are a different issue, and they're much more complicated, and there's real problems with the way we're counting COVID deaths. And, this, as you said, we've sort of known this for months too. I mean, it's crazy to me in that I wrote about this back in June with the first lockdown, or with the first booklet I wrote, and nothing has changed. And I want to point to a case that I actually tweeted about today that people can go look at and judge for themselves. This is a 29-year-old man who died a couple of months ago, and his obituary was actually written in the New York Times, and in the headline it says he died of the coronavirus. So I thought to myself, wow, that's a really disturbing case if a healthy 29-year-old can die of the coronavirus. And I asked the medical examiner in the county where he lived if it was an autopsy performed and what were the results. And they reported back to me today that he had actually his death had actually been ruled accidental due to the toxicity from two drugs, from oxycodone and from Xanax. Yeah. And that they said that COVID-19 was a contributing factor to this. So I would urge people to look at that for themselves and judge for themselves. Is that a COVID death? Does that make sense to call that a coronavirus death when the ME is saying something different?
Yeah. And CDC Director Redfield acknowledged, Phil, that hospitals do have this financial incentive to maybe play with the numbers.
We've seen this in other disease processes too. Early in the HIV epidemic, somebody may have a heart attack but also have HIV. The hospital would prefer the DRG for HIV because there's greater reimbursement. When it comes to death reporting, though, ultimately it's how the physician defines it in the death certificate. And when it comes to hospital reimbursement, there could be some play in that for sure.
Phil, how widespread is this, do you think?
Well, I think it's pretty widespread. We definitely saw it when the high impact funding was coming up, and we had those deadlines, and hospitals had to get their 100 coronavirus patients to get the $75,000 each, and they sort of crammed to get it. And then there was the second deadline. So we don't have one of those deadlines right now, but you still have that 20% plus up. You still have a lot of pressure from administrators to code it as much as possible. And in a lot of places, and by the way, prior to September 1st, they didn't even need a test. They could just say, we think this person has coronavirus, reimburse us 20% more and add that to the patient. Now the federal government is requiring that they do a test, but we know you can find a lab that'll give you a huge number of false positives or trivial non-infectious positives. And so the hospitals are not going to use a lab that's giving them lots of negatives. They're going to use a lab that's giving them lots of positives. And you look inside some of the hospitalization numbers and you see, for instance, that among women age 15 to 49 who are currently hospitalized with coronavirus, over 20% of them are pregnant. Now, To me, that suggests that they're in the hospital for a completely unrelated reason, and they just happen to have tested positive, but that still goes in the statistics.
Well, they're just they're 40% asymptomatic cases. Yeah. Well, tonight on CNN, guys, Bill Gates, he said things would not be going back to normal anytime soon.
For the next 2 years, there will be this virus. And so a lot of the things that can cause super spreading events will be very restricted even a year from now.
Alex, 2 years. In Australia, they might not let anyone travel until 2022. I read that yesterday.
Yeah, yes. I mean, and there's going to be a push to try to get everybody to take the vaccine, whether that's going to be mandated or quasi-mandated. There's going to be efforts to, continue to force masks on people. I don't understand what the obsession with not going back to normal is, with insisting that this virus is going to change our lives forever. Other respiratory viruses have not done that. Other respiratory viruses that are comparable in terms of severity, the 1968 Hong Kong flu, the 1957 flu. Forget the Spanish flu. I'm talking about stuff that, people at the time barely even noticed. And there definitely is something, there's something strange happening with the dynamic of the media, with the dynamic of the public health establishment, where there really is an effort to sell this as some world-changing event.
Well, for them,
the numbers do not support that. I guess
we need to be very careful. Yeah. We need to be very careful over the next couple of months because we're going into winter now. And every winter, you have a big increase in respiratory illness. You have a big increase in hospitalizations. You have a big increase in deaths. It's all in the baseline. But if they keep using the counting methods they are using, a lot of those normal deaths that happen every winter are going to end up in their counters and in their spinners for hospitalizations and deaths to feed the panic cycle.
You got it. Gentlemen, we got to go. But that's when when Fauci's saying 400,000, how many of those are flu deaths that would have happened anyway? And I'm sorry, but we have to call all of this into question when they're taking our liberties away. Gentlemen, thank you so much.